Hi. So this is the DVD presentation as part of the in-service on the Montreal Cognitive Assessment tool, and it's a demonstration on how to utilise the tool with a patient. I have my father here who's going to assist me today, who's also called Bill. How are you going?
I'm good, thank you.
That's good. So we're just going to go through and explain the different domains and areas of the tool and how to implement those areas. The time to administer the MoCA is approximately 10 minutes and the total possible score is 30 points. A score of 26 or above is considered normal. Before we commence the MoCA screening tool, it's always really important to ask for consent. Most people that have these sorts of cognitive assessments do tend to be very apprehensive and suffer a little bit of anxiety. So it's also very important to reassure the patient that there are no right or wrong answers and that it's purely designed to see how the CVA has affected the person. The first domain that we look at is the visuospatial and executive functioning. There are three sections here. The first is the alternating trail making. The examiner instructs the subject to please draw a line going from the number to a letter in an ascending order. You begin by asking the patient to draw a line from 1 and then to A, then to 2. The second area is the visio-constructional skills. The examiner gives the following instructions, pointing to the cube. Copy this drawing as accurately as you can. 1 point is allocated for a correctly executed drawing. The third area also looks at the visio-constructional skill. 1 point is allocated for each of the three criteria. Indicate the right third of the space and give the following instructions. Draw a clock, put all the numbers and set the time to 10 past 11. The second section looks at naming. Here, there are three pictures depicted. Bill, can you tell me what this animal is?
Lion.
And can you tell me what this animal is?
Rhinoceros.
And can you tell me what this animal is?
A camel.
So the next part of the test is memory, and this particular section you don't initially score with, it's just purely to get the patient to recall the 5 words. Velvet, church, daisy and red. Can you repeat them for me?
Face, velvet, church, daisy and red.
Okay, so I'm going to take this away again, okay, and I'm going to get you to repeat them for me.
Face, velvet, church, daisy and red.
Yeah, that's good. It doesn't matter which order you get them in, just as long as you remember them, okay? So I'm going to get you to say that one more time because I'm going to ask you these a little bit later on in the test, okay?
Yeah.
So do you want to tell me what they are again, one more time?
Face, velvet, church, daisy and red.
The next area of cognition we look at is the attention span. And by doing this, we're going to get a series of numbers and I'm going to get the patient to repeat them in a forward order and a backward order. So again, Bill, as part of this test, I'm going to give you a range of numbers and I want you to repeat them exactly the way I said them. So again, I'm going to give you the numbers, okay? You ready? 2, 1, 8, 5 and 4.
2, 1, 8, 5, 4.
Okay. Right. I'm going to give you another set of numbers now and I want you to tell them to me backwards. Okay? So the numbers I'm going to give you are 7, 4 and 2.
2, 4, 7.
Great. So the next area in attention looks at vigilance. And the way we do this is the examiner reads the letters at a rate of 1 per second. And what I'm going to do now is I'm going to read you a series of letters, okay?
Yeah.
Every time you hear the letter A, I want you to tap the table for me, okay? So are you ready?
Yes.
Okay. F, B, A, C, M, N, A, J, K, L, B, A, F, A, K, D, E, A, J, A, M, O, F, A, B. So the scoring, if they make one mistake, you can still allocate a point. If they make more than one mistake, the scoring is 0. The next part of the attention section looks at serial 7s. The examiner gives the following instructions. I will ask you to count by subtracting 7 from 100, and then keep subtracting 7 from your answer until I tell you to stop. Give this instruction twice if necessary. Subtract 7 away from 100.
93.
Okay, and can you tell me what 7 is from 93?
Is 84.
Okay, and...
86.
86,
Yeah.
okay, and can you tell me 7 away from that?
79.
And 7 away from that?
73
And 7 away from that?
is 66.
Okay, so again, the way this scoring goes, if they get 2 correct, it's a score of 1. If they get 3 or 4, the score is 2, and if they get all correct, the score is 3. Section 5 of the MoCA looks at language. Here in this demonstration, we ask the patient to repeat specific sentences as demonstrated. I only know that John is the one to help today.
I only know that John is the one to help today.
Okay, and the second one I want you to do is the cat always hid under the couch.
The next part of this section looks at fluency. It asks the patient to name a maximum number of words in 1 minute that begin with the letter F.
Fun, foe, frolic, fail, find, furious.
Allocate 1 point if the subject generates 11 words or more in 60 seconds. Record the subject's responses at the bottom of the page. The sixth area of the MoCA looks at abstraction. The examiner asks the subject to explain what each pair of words has in common, starting with an example.
What I'm going to do is banana and orange. What's similar between banana and orange?
Fruit.
Okay. So the next one I'm going to do is train and bicycle.
Transport.
Okay. And the third one I'm going to give you is what's the difference or the commonality between watch and ruler?
Measurement.
Okay.
The seventh section of the MoCA looks at delayed recall. Here, the examiner gives the following instructions. I read some words to you earlier which I asked you to remember. Can you tell me as many of those words as you can remember?
Velvet, church.
Make a
daisy,
check and
red.
mark each word correctly recalled spontaneously without any cues in the allocated space. Allocate 1 point for each word recalled freely without any cues.
If they don't get all the words right, you can then use cues. With the first one, it had something to do with the body. Can you remember?
The first one, what is that?
The first word had something to do with
Face.
the body.
Face.
That's it. Okay. So, can you tell me all of them now?
Face, velvet, church, daisy and red.
Great. If they can't recall those first prompts, second prompts can be used by using multiple choice.
No points are allocated for word
As an
recall with a
example,
cue.
if
The
Bill
cue is
did
used for
all
clinical
Jones right,
information purposes only and can give the test interpreter additional information about the type of memory disorder.
was it arm,
For memory deficits
face,
due to
or leg?
revival failures,
Face.
performance can be improved with
That's
a cue.
a
For
second
memory
way of
deficits
prompting
due
with cues.
to encoding failures,
Any cues
performance does not
with the words
improve
that
with a
are-
cue. The last section of the MoCA looks at orientation. Here the examiner gives the following instructions.
Can you tell me the date today?
The 4th of June,
And can you tell me the month?
June
Can you tell me what year it is?
2014,
Can you tell me what day it is?
Wednesday.
And can you tell me where you are?
I'm in my sitting room,
And do you know the city?
Sussex Inlet.
Okay.
It's not
So
a
I
city.
hope that helps with the implementation of using the MoCA with patients. It is quite complex and it does take a little bit of practice. And I thank you, Bill, for joining me today and helping me out with the demonstration.
I hope I was of some assistance. I didn't get it all right though.
Thank you.